2004 and is comprised of community leaders, health professionals, and families who've been touched by dementia, including Alzheimer's disease. The MACAB works with Johns Hopkins Alzheimer's Disease Research Center and the Johns Hopkins Memory and Alzheimer's Treatment Center and various other groups to increase community awareness and access to healthcare, knowledge, research opportunities related to Alzheimer's disease, memory loss, and senior health. Our mission is to focus on 4 of the most critical needs addressing the impact of dementia, including Alzheimer's disease and related disorders of the greater Baltimore residents and caregivers. These include education by increasing access to Alzheimer's disease education and care interventions, recruitment to enhance the integrity of Alzheimer's research through recruitment of diverse and ethnic racial groups, communication about research and providing a forum for community concerns about research. And then we look to revise our procedures and improve research so that it's consistent with community goals. And like last year, we are still virtual, as you can see, due to continuing concerns about COVID-19. But we do hope that we get to be in person again sometime soon. And even though many may not yet feel comfortable meeting in person, we're pleased to be able to meet virtually. And we hope that those of you who requested one of those restaurant gift cards, which I hope you received yours, I got mine. It's a small token of appreciation that we want to share with you for your continued contributions to MACAB and attendance to tonight's event. Our hope is that you will be able to enjoy dinner at a restaurant of your choice, either this evening or in the near future. So this year's meeting is attended by board members as well as a number of guests. So it's smaller than it usually is, like our virtual private dinners from last year. However, we hope to make portions of this event available online, as you noticed, we started recording, for others to view afterwards. So we have our agenda that we're going to share. And as you can see, I think we're moving a little bit faster, but that's okay. We have a couple of speakers with us tonight. Marlon Taylor, who's going to discuss building reach through partnerships with HBCUs. Travonia Brown Hughes, using digital communities to study aging and memory loss in Black older Americans. And these will be followed by the call to action and closing remarks and a networking activity that I think is going to be pretty fun for us. So I hope you can stay with us. Each talk will be followed by a live Q&A. Your questions will be addressed after each talk during this Q&A session, and there are 2 ways you can communicate. You can type your questions in the chat of the Zoom box, and our moderator, who is Ashley, will read them as they come through. Or you can click your Zoom raise hand button, which can be found under reactions. And during the live session, Ashley, our event moderator, will call on attendees who have raised their hand. And attendees will be invited to ask the question by unmuting their microphone and turning on their camera if they so desire. So before we begin our talks, we thought it'd be a good idea to have everyone do a very brief introduction, since we have a few invited guests in our attendance. We asked board members to briefly introduce themselves, maybe mention how long you've been on the board, but we do have short biographies that have been included that we can share with you. We just ask that you give your name, maybe your affiliation, and how long you've been involved with the MACAB. As for our guests, we ask that you give your name and the reason you were interested in the aging and dementia, and answer the question of this and that, which we're going to put on the screen for you. It's sort of a little game for us to get to know you first. So I will begin. As I said, I'm Jackie Seth, and I've been with the MACAB for probably about 10 years. I think it has been. And I'm also the founder and executive director of Curing Alzheimer's Now Dream Foundation. We're an organization that looks to raise awareness of Alzheimer's disease among students in the Maryland, DC area and throughout. So I will toss it over to our next board member. How would you like me to handle this? Let's see, should I just throw a prize and see who goes first?
That sounds perfect.
Okay, well, Corinne, you spoke first, so you get to go.
Silly me. All right, I'm Corinne Pettigrew. I'm an assistant professor in neurology, and I work with the Outreach Recruitment Engagement Core of the Johns Hopkins Alzheimer's Disease Research Center. I've been with the MACAB for 5 or 6 or ish years now. I'm not sure. A handful, though.
That's what I was thinking. All right, Miss Peggy, would you like to go next?
You have to unmute.
Can you unmute yourself, please?
not done so. Good evening. I'm Peggy Sylvia Jackson. I've been a member of MACAB for about 6 years, I think. I am a retired, glad to be retired, educational administrator for City Baltimore in the state of Maryland. And I am a facilitator for a Alzheimer's caregivers support group at Sharon Baptist Church. In addition, I spread the word about Alzheimer's with ASALA. ASALA is an organization. The acronym stands for ALH, Association for the Study of Afro Americans. Thank you.
Thank you, Ms. Peggy. I'm gonna go to Ms. Thomasine.
Okay. Good evening, all. My name is Thomasine Baskerville. And how long have I been a member of MACAB? Forever. That's as long as there was a MACAB, I've been a member. One of the founding members of MACAB, and it's been a joy. And I think that if they ever thought about getting rid of me, they haven't let me know about it yet, so I haven't gone anywhere. I'm a social worker, supposed to be retired, but I just renewed my license last week, so that's how much I'm retired. I enjoy working with people. I'm a caregiver. I had been a caregiver for my father who had dementia, who died a long time ago, and it was actually after his death that I met Crystal Evans doing a speech in the community about dementia, and she invited me to participate in some of the programs at Hopkins, and I got caught up in it, and I'm still here.
Thank you, Ms. Thomasine. We'll move to Crystal then.
Oh,
Crystal
which
Evans,
Crystal?
sorry. I'm so
There are two
sorry.
Crystals.
My apologies. Crystal Evans,
In
please.
so many, I have to step back from my friend and colleague, Dr. Black. So Dr. Day Black. So my name is Crystal Evans, and I'm one of the founding members of MACAB. And just as Thomasine said, MACAB is like something you become involved in and you never want to leave. So I have returned after a brief hiatus of a couple of years, and direct a lot of community outreach for the institution. So I'm just happy to be here today. Thank you.
Thank you. Dr. Crystal Day Black, let's move to you.
Hi, everybody. I got my flowers. Okay, I'm just sharing my flowers here. Hi, I'm Dr. Crystal Day Black. I recently retired from Coppin State University School of Nursing after 25 years as an associate professor. And I'm also 40 years as a professional nurse, psychotherapist in the state of Maryland, board certified. And I have been engaged not only in the CAB, probably right after Ernestine and Crystal. Yeah, they all kind of brought me in right behind it. So what is it, 15, 16, 17 years or something? I am actually active in the Alzheimer's Association as an ambassador. And so I've been doing a lot of lobbying and teaching in the community. And so now that I'm retired, I'll be going out to health fairs and doing resources because I got some free time to be able to do some stuff for y'all now. Amen.
Thank you, Dr. Day Black. All right, let's move along to Misha.
Let me unmute myself. Hey everyone, I'm Misha. I have been a member of the board for 2 years. I'm the owner of Moxie Moves. I help the elderly keep their mojo through fitness and brain games. My grandmother had Alzheimer's from 2010 to 2019. So that's what inspired me to join the board, because she died from the complications of Alzheimer's.
Thank you, Misha. Ms. Tarago.
Good evening, all. I'm Terrico Epps, and I've been on the board as long as Corinne. So it's like, I think what about, I don't know, 5 or 6 years. It seems longer though. But anyway, I was inspired to be on the board because I too was a caretaker for my mom for 9 years as she was diagnosed with Alzheimer's. And out of that journey, I learned so much, and I put some of it in a book. And have been advising or helping people, or coaching, as I was called. A caregiver's coach is what I've been called, to just kind of help people navigate the journey.
All right, Andrea.
Hi, everyone. I'm Andrea Nelson. I'm a nurse and the Director of Memory Care Programs over at the Johns Hopkins Memory and Alzheimer's Treatment Center. And I'm one of the founding members. So always thrilled to be back.
Thank you. Mary Ellen.
Hi, I'm Mary Ellen Smackham. I've been a member about 4 years, and my focus is community outreach.
Thank you. Anna.
Good evening. Good evening. I've been with MACAB for about a couple of years, and definitely love this group and being on this board. Hospice care consultant and area leader of health equity for Accent Care, and chair of the education committee as well. So thank you for having me tonight. Always a pleasure.
Thank you, Anna. Ms. Deborah Peace Coleman.
Good evening, everyone. I am Deborah Peaks Coleman. I reside here in Baltimore. I work as the program director for Women's Foundation in Washington, D.C., and I soon will be retiring in 53 days. I'm looking forward to that so that I could pursue my passion of being a health and wellness advocate. Thank you.
Thank you. Miss Eloise Main.
Hi, everyone. I am so sorry I can't share my picture. I don't know what's going on with my camera, but I'm happy to be here this evening. I am Eloise Main. I want to talk about retirement, but I'll move on past that. Glad
I think a lot of us do.
Retirees have joined the force, but again, we don't get tired of serving our community, so we go back a second time around. So my second time around, I am the Chief of Client Community Services with the Maryland Department of Aging, continuing to connect with MACAB. I'm one of the original board members, and just excited to be here this evening.
Thank you. Dr. Albert?
I'm Marilyn Albert. I'm professor of neurology at Johns Hopkins. I'm the director of the Alzheimer's Disease Research Center there. I've been involved in outreach in the community as long as I've been doing research in Alzheimer's disease, and I'm not going to tell you how long that is. I'm a founding member of the MACAB, and it's really great to see so many people here who helped to set it up and still passionate about it. It's really great to see you all.
Thank you, Dr. Albert. Cassie.
Hi, everyone. I'm Cassie Gibson. I'm a community outreach specialist with the Outreach Recruitment and Engagement Corps at the Alzheimer's Disease Research Center. And I've been working with MACAB about a year.
Thank you. Ashley, although we all know Ashley.
Hopefully everyone can hear me. I'm Ashley. A lot of people know me as the secretary for the MACAB, which I love doing, but I'm also a research program coordinator for the Outreach Recruitment and Engagement Corps at the Johns Hopkins Alzheimer's Disease Research Center.
All right, thank you. Okay, so Marlon is one of our speakers, but I still like to give her a chance to introduce herself. Marlon.
Good evening, everyone. Again, my name is Marlon Taylor, and I've been on the board of the MACAB for 4 years. I've been with the Alzheimer's Association for 4 years as well, and I am the program manager there under diversity and inclusion. Thank you.
Hi, and Maria.
Good evening, everybody. My name is Maria Gray Bowie, and I just want to mention that I was so inspired by Crystal Evans back in the 80s. I joined the board around 1984 with Thomasine Basterfield and some other people. But I'm a retired director from the Woodlawn Senior Center. It's been 4 years now. I'm loving it. And I retired, and now I'm a caregiver for my mom. So she'll be 98 in a few months. And I just love the MACAB board, and I just enjoy working on it. And I'm just glad to be a part of it forever.
Well, thank you. Thank you. So we'd like to turn it over now a little bit to our guests that we have. So we have some friendly faces that are joining us this evening. I'd like to start with Jasmine.
Good evening, everyone. My name is Jasmine Simone. I am a senior research program coordinator, specifically focused with outreach, recruitment, and engagement at Johns Hopkins. And I work currently on the study of precision aging network and Healthy Minds for Life study. And I was invited by Ashley and Cassie, and I just started at JH in July.
Welcome. And Chanel.
Good evening, everyone. I want to say thank you for the invitation. I was invited by Terrico, and I'm interested and involved because I've been a caregiver for 20 years, 18 years for my late father who passed in 2020, and for my mother most recently. And I am a coach and advocate for education and awareness, and just really telling people about how to navigate this journey of dementia.
Thanks for coming. Caroline? Carolyn?
Yes. I was on mute. Hello, everyone. I'm Carolyn Alexander. What a pleasure to be here this evening. And my main interest, or my interest in participating tonight, and I hope maybe even in the future, if allowed, is actually for community outreach and to bring some of the interests and concerns of people who have mild cognitive impairment, and to actually open up a way where they can not only get information, but maybe even prevent further progression with something like that. So being a part of participating in something with you all would definitely be a wonderful resource to give and receive. So I thank you, Ms. Ashley, for sharing this with me, especially.
Well, thank you for coming. And I think we have one more, Tiffany.
Evening, everyone. My name is Tiffany. I was invited here to this meeting by Jackie, so thank you, Jackie. I'm currently pursuing my MPH at the University of Maryland College Park, and I am the acting program manager for the Can Dream Foundation. And I want to say my interest in the aging department kind of stems from my obsession with healthcare, and just anything surrounding the brain has always piqued my interest. So when the opportunity to intern with Can Dream came about, I just immediately jumped on board, and I've just been assisting with like the activities as far as our Can Dream Day coming up next month in November, and with other related events like our pet talks that we are currently working on. So
thank you, Tiffany. And Ms. Hammond Davis?
Hello, I'm Cynthia Hammond Davis. I was invited by Ashley Scott, and I am hoping to be a participant in some of the Alzheimer researches at hospital. So glad to be here. Thank you.
Thank you for joining us. And last but not least, our favorite, Ms. Travonia Brown Hughes, my heart from when I first joined. She's going to be a speaker as well for this evening, but go ahead.
Well, thank you for having me. I was invited by Dr. Pettigrew. Again, it's wonderful just to be back home. My name is Travonia Brown Hughes. I am an associate professor at Hampton University in the School of Pharmacy, although my background and PhD is in gerontology. I was blessed and honored to be able to do a fellowship with Dr. Marilyn Albert from 2010 to 2012 at the ADRC Center. I also was at one point a member of the MACAB. Again, it's so wonderful to just see so many familiar and beautiful faces. So thank you all again for just inviting me to come back home.
Thank you. And thank you everyone for sharing so much of yourselves and introducing yourselves. We really appreciate having you here. So with our introductions done, I'd like to introduce our first speaker. Marlon Taylor is a Diversity and Inclusion Program Manager for Alzheimer's Association Greater Maryland Chapter. She oversees a number of Maryland chapter programs that provide education and support to communities, caregivers, and persons with Alzheimer's disease and other dementias. This includes building relationships with local organizations in diverse and underserved communities, providing care consultations and referrals to help families navigate to programs and services that meet their individual needs, and managing the Caregiver Respite Care Program grant, among others. Ms. Taylor will be presenting on behalf of Eileen Rosenthal, who is the Program Director for the Alzheimer's Association. Ms. Taylor.
Thank you so much, Jackie. Let me just apologize. I have a really bad cold, so I hope you all can hear me pretty good.
We can.
Great. Ashley, will you, I believe Eileen sent you excellent PowerPoint. Again, good evening, everyone, and thank you so much for coming. So we're going to dive right in. Again, this title of the presentation is Building Reach Through Partnerships with HBCUs. Next slide, please. So I know you all wanted to, our new executive director to really do this presentation, but unfortunately, he was pre-engaged for another event. So our new executive director is David McShay, who is absolutely fabulous, the executive director of the Greater Maryland chapter. David began his career with us June of 2020, exactly in the depths of COVID-19. So his career spans under the voluntary health agencies. And just a little about David, we did not get to actually meet David until I think 2 years after 2020. So it's really good to be in person here. David spent 16 years at the American Diabetes Association and 7 as the National Walk Director and 5 as the Executive Director for the Maryland chapter of the American Diabetes Association. As you can read a little about his bio, David is so passionate about the Alzheimer's Association because, as you can see, his grandfather passed with being diagnosed with Alzheimer's while he was 10 years old. And he constantly speaks about the loss of that, the loss of the relationship, of getting to know his grandfather a little better, and his grandfather in turn getting to know him. And again, another family member, his uncle, passed from a rare form of dementia in 2015. So David is really passionate about doing what we need to do to reach out to the community, to let them know about all of our free programs and services and how we can better communicate and get the information in the communities. David lives in Catonsville with his wife, Jennifer, and 3 cats. And David does sing and play the guitar in a band with lifelong friends. And he does have a good sound with him. So if you need something during the holiday, you can reach out to David and maybe he'll give you a little snippet of it. I'm done. I'm good, Ashley. Thank you. You can advance. Thank you. So gender, racial and ethnic disparities in Alzheimer's prevalence in clinical trials. As you can see here, where it has about the 2/3 of Americans with Alzheimer's are women. Women in their 60s are more than twice as likely to develop Alzheimer's disease over the rest of their lives as they are developing breast cancer. That's something that is still coming out. As you can see again, and I'm sure most of you know, that older Black and Hispanic Americans are disproportionately more likely than older whites. Older Blacks are 1.5 times more likely to be diagnosed with Alzheimer's than the whites. And Hispanics are, I think, a half. I'm sorry, my brain is kind of fuzzy with this cold. I think I may have the statistics on the Hispanic wrong, but I know they're below the African-American population. And even on this gender and racial and ethnic disparities. Sometime in June of this year, the Alzheimer's Association sponsored a conference in Washington, D.C., where the focus was on addressing health disparities. This was the second conference that we sponsored, and along with the National Institute on Aging. That event explored the disparities in prevention, diagnosis, and treatment of Alzheimer's and other dementia, while also connecting early career and senior investigators to network and mentoring opportunities. As you can see here, I don't like really reading everything, but you can see that. The next slide, please. And you can go on our website. You can leave it right there, Ashley. You can go on our website to get further information about that 2022 conference that was held in Washington, D.C. We have all of that on our website at alz.org. Now, this is talking about the discrimination. We know this discrimination exists. I really like this particular slide because it breaks it down in the statistics of it. And unfortunately, African Americans still are high in the discrimination. These populations, as you see, we are still reporting somehow, somewhere during the healthcare system, the healthcare, we still experience discrimination, and African Americans, again, rising the bank at 50%. And we still wonder why we don't get the care that we need. So you can see the stats there. Next slide, please. Partnering with HBCUs. This is something really, really big that the association really wants us to get involved in, again, because of the high statistics that are among the African Americans, as well as Hispanics. Those are our targeted populations right now to get the information out to those communities so that we can provide ways to reach those communities. Again, we need to go where they are, where they live, where they work, and have those open conversations with them as to how we can better communicate, how we can better reach their community to put in place what needs to be put in place. The potential to attract students to dementia-related professions is another important mean as we partner with HBCUs following their graduation. And also it provides an opportunity to engage with the faculty member, as we have a few faculty member here, Dr. Crystal Day Black, who could put in real good heavy words on that one, just partnering with them so that they can incorporate that information about Alzheimer's and other dementia within their curriculum for the nurses or even the social work students, or it can go across. It's not just in certain fields. We can actually work with any population within the universities. Next slide, please. So partnering with Coppin State University, the Helene Field School of Nursing. This is a long-time partnership. Again, as I stated earlier, I've only been with the association for 4 years. Prior to my coming, it already existed. We're in our 18th year, excuse me. We're in our 18th year with our annual Pythias A. and Virginia I. Jones African American Community Forum on Memory Loss, which it did not start, I believe, at Coppin, but that is the home center for it, that event. The faculty serve on the planning committee, Dr. Crystal Day Black, and another faculty member serve on that planning committee. And the nurse, I'm sorry, did someone say something? Okay. and the nurses during that event, which will take place in person November the 5th of this year at Coppin State University. The nurses will provide health screenings for the attendees, and also the social work department. The students will also volunteer and participate in the event. Next slide, please. And just to say a little bit more about Coppin, you can still leave it here, Ashley. One of the other really great events that came out of that annual event is that we got to go out into the communities to talk to the faith communities, to let them know about our free programs, our free services to each house of faith in those communities. So it's not just anywhere. It could be in a professional place, a barbershop, a hair salon. We have wonderful partnerships with different pharmacies. So we need to go everywhere. This was, this particular photo here, I think that may have been our largest nursing class cohort, where they work with us. And Dr. Day Black was instrumental. She did all of this. She actually incorporated part of, within their curriculum, the community assessment, where that was part of their clinical studies, but it also benefited the association because they were getting the information out in their communities about the association, about the disease, the education, the programs, the services. So again, as you can read all of that, it is a fantastic partnership with Coppin State University Nursing. And we look forward to our continual work with them because it's nothing like it. They bring new breath, new life to looking at strategies, creating strategies, actually getting more partners in the communities. Staff, you don't have enough staff members to go out in the communities, and this is where they as well help with that. So the opportunities are endless, and we are still working with them. I'm working with a cohort of nursing students now. We meet each and every Monday for 1 hour to go over their deliverables, what's expected of them. And again, all of that is rolled into their clinical studies. So it's just a fabulous partnership that we have. Next slide, please. Excuse me. We also have a partnership with Morgan State University. This is through the Thurgood Marshall College Fund. And it's basically the same deliverables, if you will, as with Coppin State University nursing students, where we want them to go out, to make those connections within their university so that we can have partnerships with the professors, as we do with Dr. Day Black before she retired. So it's the same focus. It's the very same focus. And then another addition to that is that we can introduce those students in the different fields about maybe going into geriatrics or some field that where they could help. They could make that difference. They could be, that person that makes that difference along with so many other scientists and advocates and things like that. Next slide, please. So again, it's basically the same. Like I said, you could read it. I really don't have the breath this evening to read it, and I don't want to insult anybody. So I just received my intern. It's one intern at Morgan State University versus Coppin State. It's the actual class. And the Morgan State University, it's a paid internship. So however long that they need to stay there with the association, that's how we work out their information and their contract, if you will. Next slide, please. We also are partners with the University of Maryland Eastern Shore School of Pharmacy. We do have some pharmacy students that are involved, most dedicated to the Salisbury Walk, which I believe is this weekend coming up. So they do participate in that. And one of the professors there, Professor Rodriguez Weller, she is a volunteer caregiver educator for the Greater Maryland chapter of the Alzheimer's Association. So we're still looking to expand, still looking to speak to other faculty member and just get more partnerships. Again, we need more partners that are bilingual so that we can reach more people. Unfortunately, right now, we do not have a bilingual staff person at the Greater Maryland chapter, so that does hinder us somewhat, but we are looking for more volunteers to help us to reach the community. Next slide, please. I think that may be it. So thank you, and let me know if anyone have any questions.
Thank you, Marlon. I sympathize with you with that cold. I had a cold this week as well, so we really appreciate you persevering and helping to present that information. I want to provide everybody with the opportunity to put your questions in the chat or simply raise your hand and we can acknowledge you and you can come off mute. We have a little bit of time before our next speaker to allow some space for that. Okay, we have a hand raised, a couple of them. Go ahead, Ashley.
I was going to say skip me and go to Trevania.
Can you hear me? Okay. So I really enjoyed your presentation, Ms. Taylor. Please do keep in mind Hampton University, also Norfolk State University, if you should need additional partners, with your initiative. So we would love to come on board and help in any way that we can.
Well, I will say this, thank you so much for letting us know that we do have different chapters around the US. So depending where a person lives, that's how they somewhat route the partners, if you will. So with the Greater Maryland chapter, we serve all of Maryland with the exception of the southern counties in Maryland, and another chapter picks up those counties.
Got it.
So if you are interested, all you would need to do is to call our 24/7 helpline, 800-272-3900, and let them know that you are interested in participating or working with your local chapter, Alzheimer's chapter, and believe you me, they will ring your phone off to work with you, because I certainly would. So thank you again for that.
I'll do that. And I work with Elisa Lofton.
Yes, I just met with Elisa today. Yes, we all are in the same region, but the chapters are different. So yes, she's under the Virginia, I believe, chapter. So yes.
Okay.
So you could just reach out to her if you have her number as well.
Love the networking. Terry, go ahead.
Trevania, Marlon, thank you for your presentation. It was excellent. And really, I've loved watching this internship program evolve over the last couple of years. And it's just amazing what you've been doing. Trevania, I wonder if it could serve as a model for your chapters, for your local chapters association, for, kind of having interns in the community and building that partnership.
Yeah, most definitely. And I do think that Elisa has worked with Dr. Ethlyn Gibson, and she is in the School of Nursing. And in our gerontology minor program, they've had some of their undergrad students matriculate, as interns at the Alzheimer's Association. But I don't know if we've done it on such a large scale or made it as formal as it seems like it's become. So I think that's something that we can continue to develop. But I think it's an excellent idea. And I was thinking in my mind, you all are reaching out to members of the community and you're utilizing your nursing students. And I was thinking, how about public health students? How about even journalism students helping with the educational piece? So, there are a lot of different schools and colleges that might be able to offer their expertise.
You are absolutely right. Again, that's why we really, as we work with one faculty member, we can try to partner with others within that university. So, because it's needed throughout the community as well as the association. So you are absolutely right.
I guess that partially answers my questions, because I can understand the focus for HBCUs because of the terrible statistics. But it would seem that we would look at other institutions as well, other colleges as well, and not just, as Travania said, not just nurse schools that have nursing programs, but even other programs, because this, to me, this information is so critical, and we just want to get it out as broadly as we can, because of the devastation of it. So, is there any plan to expand beyond HBCUs, or are these just the models to kind of get it like concise before expanding it larger?
No, we actually are, well, I'll say this, I'll speak for myself. I have actually reached out to different colleges, Baltimore City Community College, other colleges around here, to just get into the career services and have that conversation. But right now, again, with COVID, it is really, really hard for the doors to open. It really is. Even for the House of Faith right now, it really is hard to get in the door. So that's why the Coppin students, as well as the Morgan State University student, that's where they can help with, legs on the ground, just getting out into the community. It's only one of Marlin. And, but no, we want to reach everyone. Just as I said, one of the things that we do with Coppin students, we have an orientation for each new cohort of students that come on board. And what I do, I give out packets of different types of folders. One packet is for the local House of Faith, for them to reach out in their community. Another packet is the professional packet, for them to go to the businesses in their community. Another is the AME Church. We have a national partnership with the AME Church. So whatever, if they have that church in their community, it's whatever agency, store, whatever is in their community, that's where we want them to go. And they have the information to make that connection. So yes, Dr. Day Black, I'm going to let her roll in here, because this is the mother of Coppin State University.
Hi, everybody. This was a brainchild of mine several years ago. First of all, in nursing school, it's so hard to get clinical placements. That was the first thing. So you start being very creative. So being a part of MACAB, being a part of the Alzheimer's Association, and this is a passion and baby of mine, how can we reach the community? And the one thing we do know, although I humbly respect all of the other disciplines, love you all, we do that interprofessional model, but nurses are the most trusted according to the Gallup polls for over 10 years. And people talk to nurses. The other thing is with nursing students, we know that nursing students, based on communication skills and all the things that they are in this generation, not necessarily can relate. okay? So this gives them exposure in working not only with caregivers, but individuals who may also have the disorder. And going out, they actually start out with a community assessment. Each one of the students is assigned to a zip code area, and usually it's the zip code area of a Hispanic or African-American communities. And so they, again, all boots to the ground. So they do some walking around, they do a community assessment, and then they roll out survey. The survey is a modified survey. The original survey, when we first looked at it from the Alzheimer's Association, was probably about 20 pages, 25 pages. Nobody is going to answer a 20-page survey in this day and age standing on a clipboard. It's just not going to happen. Then COVID happened. So the students looked at what was the critical demographics, what are the critical questions. The goal was to look at how we can reach the community. What are some of the things that we are missing? And so, and based on that survey, we were able to capture, for example, with the Hispanic community, they don't watch a whole lot of TV. So why you got all those TV ads in Alzheimer's? They're not watching it, okay? And so if you're spending if you got a budget of $100,000 and you're putting it into media, what kind of media do you want to put it into? So the students were able to tease out. Now we've been doing this probably what, 5 semesters now. And so each cohort keeps coming up with something unique and different. Found out this is Hispanic organization that most individuals are aware of on Facebook. It's a Facebook group. And so I wouldn't have known about that, but one of our Hispanic students knew about it and approached them and was able to get more information that we've ever had before. We have gone into shopping centers. We've gone into the laundromat. Believe it or not, the laundromat on Saturdays or something, and surveyed people where they work, where they play, where they worship, and all the particulars. And so it has been an exciting venture. It also taught students not to be so shy when interviewing. Now, on the flip end, after they graduate, many of them are working in the ER, they're working in acute care settings. And so working with families who bring their loved one in, they're a little confused, okay? They got a UTI, or there's something else. They have delirium, dementia, and depression. So they're able to tease it out and be able to provide the 24/7. They memorize the number and they're able to give that information right on the spot and say, hey, look, your family's going through something. I know of a organization. Each student gets an opportunity to rotate as part of their orientation into several levels. And so I think if they go to a support group, so they can say that I was at a support group, and the various types of support group, early onset to late onset. They have the LGBTQ and others that they have. And so they get a chance to go to that. They go to an education class. So there's several things that are going on simultaneously within the context of the rotation. With those deliverables, they're told at the beginning, at the end of the clinical rotation, this is the expectation. The students put together a PowerPoint slide where most of the time there's up to 10 students in a clinical, and they pull all of their resources from all the different zip code areas, and then they combine to see what populates up, or bubbles up, and to see where there's some commonalities, and they share the information. The inaugural group actually wrote a 45-page research paper that got us started. And now each semester thereafter, the students are adding. Okay, it's like, okay, so I don't have to write the paper, praise God. Okay, there's no more 40 pages, Ms. Black. No, we got the basic information. We're using the health belief model and some other things to kind of put that together. And so it has been an exciting time working in partnership with the Alzheimer's Association and making sure that the students are sensitized to all of the needs that are done. So I'd like to thank Marlon and Miss Eileen and all the people there. The orientation has been fabulous. And so, yeah, I'm gonna miss being there, but I still be on the perimeters helping you out.
Thank you very much. Chanel?
Yes, my question for Marilyn is, are there plans to do outreach to hospitals? Nurses clearly understand, doctors know it, But from a caregiver perspective, going to the hospital, everyone from security guards to food service people, everyone doesn't understand, and families are sometimes tormented. I've literally had to talk to hospital leadership to advocate and complain about how my parents were treated. So have you thought about educating them as to how to respond to dementia patients in the ER or when they're admitted to the hospital?
That's a great question, Chanel. And yes, the answer is yes. I personally do not do that. We have another staff member from our home office that works directly with the admin of the hospitals and things like that to get the education programs into the hospitals to the staff members. So we are there as well. Yes, we cover those bases as well, but that's not on the local level. But I can go into a local center, a local, let's just say a community hospital, if you will. I can go into there and speak to someone about that. But nationally, that's done on a home level, a home-based level.
All right, thank you, Marilyn.
Thank you
Marlon, we
so
really
much,
appreciate
everyone.
that. And
I'm
thank you.
not sure. Hi, I had my hand up.
Oh,
I'm not the doctor, Crystal, but I helped found the place and write the mission statement, all due respect. But are you guys engaging community health workers? They are an excellent resource, or maybe they fall too much into that. No, if you work with nurses, I could see you working with the community health workers as well. They're a valuable resource, often out in the community doing blood pressure screenings, educating about all of the cardiovascular health resources. And I know, like, I actually worked very closely with the CHW programs at Hopkins. And so it just seems like a natural fit. I'm not even sure if Alzheimer's is on their curriculum, but boy, wouldn't it make sense. I guess that's something else for Marilyn and Corinne to do, but just, I didn't know if that fell under your education, like the arm you were talking about, but I thought I would at least put that out there because community health workers have their boots on the ground. They are really phenomenal people.
For the community, yeah. Was somebody going to say something? Crystal, were you going to say something? Okay, I'll move forward. For certain areas, we again have to get the approval from our home office as far as for how far we can go in to different areas, excuse me, to go into different areas, but I'm going to write that one down.
I'm telling you.
Thank you, ladies.
I'm going to write that one down, so thank you.
Okay. In the interest of time, I'm going to ask if we could put our next questions in the chat and maybe Marlon can address them because we'd like to introduce our next speaker, Dr. Travania Brown Hughes. Dr. Hughes is an associate professor in the School of Pharmacy at Hampton University and assistant community professor at Eastern Virginia Medical School. She has over 15 years of aging research experience. Her experiences and research interests are grounded in the study of cognitive aging in minority populations and health disparities. She's been active in developing and facilitating several research and community-based projects with a focus on cognitive aging in diverse populations, barriers, and facilitators to clinical research participation among minorities and health disparities in vulnerable populations. Her current research focuses on the identification of differential risk factors of the early progression of Alzheimer's disease. Dr. Brown, the floor is yours.
Can I share my screen?
Feel free. We're seeing it.
All right, hold on one second. I was just looking for. I'm sorry, my presenter screen, for whatever reason, it's not coming up. I don't know quite why. I'm sorry.
It's okay.
Hold on, I'm gonna stop sharing real quick. Okay, I think we're good now.
We are.
Okay, perfect. Oh, tell you what. All right. Okay. Thank you so much for the opportunity to present. It's truly an honor to be invited, and I'm happy to be back home. It seems like just yesterday we were all together, and since I don't have much time, I just want to go ahead on and get started. And my talk today will cover using digital communities as a mechanism to study aging and memory loss in Black older adults. Okay, I have no disclosures. And as we know, African Americans are twice as likely to develop Alzheimer's when compared to whites. Alzheimer's disease is the 6th leading cause of death in the US, but among older African Americans, it's the 4th leading cause of death. How a disease is perceived is important because disease perception strongly impacts health behaviors, symptom recognition, and the decision to seek a diagnosis. The African American United Memory and Aging pilot study focused on African Americans in an effort to consider the within group heterogeneity that is lacking in many studies. I'm sorry. Okay. Despite these statistics, studies continue to report lower participation rates among African Americans in clinical and Alzheimer's disease research studies. The literature attests to a reluctance among African Americans to participate in research, and some of this, rightly so, stems from a mistrust of formal institutions, and this lack of participation among African Americans in research has led to limited generalizability of study findings, and also it has led to a degree of uncertainty regarding risk for dementia in minority populations. So again, how can you generalize research findings to a population that is not present in the clinical studies that you're basing these findings on? Jennifer Manley once said, and I quote, "When minorities do visit clinics, they tend to be in later stages of dementia, which becomes more costly to treat and a greater burden to caregivers. The challenge is finding ways to engage at-risk patients much earlier. Traditional recruitment methods incorporate community-based research practices, but how do we define communities? As researchers, we must broaden our definition of the word community. When we think of community-based research, it is often done with a group of people living in the same place, in close proximity to each other in a particular geographic location." So again, when we think about communities, what do we usually envision? We envision members that comprise a community, but they're usually within close proximity to a particular university. So again, how can we broaden that idea of what a community truly is? Research does not have to be relegated to just a group of people who live in the same place and share the same zip code. With online communities, membership is not determined by proximity. A group can be a group of people who share common beliefs and interests and values, regardless of where they live. My particular study, the African American United Memory and Aging Project, I was able to recruit participants from 91 different area codes. Targeting online communities is an innovative recruitment mechanism, and it is not bound by location or distance. Online recruiting is cost-effective. I did not have to pay a research assistant to administer the survey face-to-face, nor did I have to pay for postage. Online recruitment offers the ability to access large numbers of people. Participants share characteristics, but have more variability beyond that of that which is in their geographic area. My participants were all African Americans. They all had a bachelor's degree or higher, but they did not live in the same area. Researchers can target certain groups online, and I chose to target sororities and fraternities and African-American professional groups and common civic organizations. I reached out to gatekeepers, sorority and fraternity chapter presidents, board members, basically gatekeepers that had access to a listserv. This established an element of trust, as the individual who reached out to the members on my behalf was someone that they trusted. So if these individuals had gotten an email from me, they probably wouldn't have opened it. But because this particular email was coming from their sorority or their fraternity chapter president, they opened that email and they read it. Instead of going door to door, I reached out to those people who had access to a lot of people at one time. According to a recent survey by the Pew Research Center, 75% of U.S. adults now own desktop or laptop computers. 96% of these individuals also own a cell phone. In particular, they own a smartphone of some kind. Questionnaires can now be easily accessed online or downloaded via a mobile app. One might ask, do older adults really use technology? Well, it's growing. In another study by the Pew Research Center, they found that in 2000, 14% of older adults aged 65 and older were internet users. But by 2019, that number had jumped to 73%, and slightly over half had a smartphone. Truly, I believe post-pandemic, that number has jumped even more. Now you have older adults who attend church services online. So because of necessity, these individuals had to become more technologically astute. So yes, older adults can and do use technology. Online recruiting allows researchers to expand beyond the communities located closest to their university. Computerized mobile app and telephone-based cognitive screening tools are convenient and cost-effective. They are an alternative to neuropsych paper and pencil testing that can be very time-consuming, and someone must administer the test. Computerized testing is efficient. It offers real-time data entry. It can be done at a reduced cost. And also because it can be used at home, it can be used to reach individuals who are located long distance. So it doesn't matter that someone is in California or someone is in Florida and you happen to be located in Maryland. Utilizing that digital community or that digital reach allows you to interact and to reach that person. With pilot funding from the Johns Hopkins University Alzheimer's Disease Resource Centers for Minority Aging Research, also known as the RICMAR, I created the African American United Memory and Aging Project. The aim of the study was, one, to examine perceptions and levels of knowledge regarding Alzheimer's disease among a cohort of midlife and older. My participants were age 50 and older, college-educated African-American Black men and women. So my participants had to have at least a bachelor's degree or higher, and to see if perceptions vary by demographic factors. Local alumni and national sorority and fraternity chapters and civic organizations were contacted via email and invited to participate in the study. I specifically targeted certain groups and organizations because I was so afraid that my study link would fall into the wrong hands. So I chose not to post my study link on Facebook and not to share the link via Facebook and Instagram. Again, there has to be an element of trust when you're using technology, when you're accessing digital communities, because anyone can get your link. I chose organizations to target that I knew I would find an educated cohort of African Americans, like sororities, fraternities, Black professional civic groups, and organizations. And although I will say I am a proud member of Alpha Kappa Alpha Sorority Incorporated, I don't know if any AKAs are in the house. I will say, and I know Miss Ernestine I was looking for, but she's not here. The members of Delta Sigma Theta Incorporated showed up and they showed out. About 70% of my participants came from Delta Sigma Theta Sorority Incorporated. So I am very thankful, very, very thankful. I see some hearts, so thank you. Participants had to identify as African American or Black, be 50 years of age or older, have completed a bachelor's degree, and not have a diagnosis of Alzheimer's disease. Participants were compensated in the amount of $25 in the form of a Walmart gift card and given another $25 once they completed the online computer and telephone-based cognitive screen. Fourth year PharmD students were trained to administer the telephone interview for cognitive status via the telephone. And again, I want to just reiterate that it's so important to pay your participants. It's so important for them to know that you value them and you value their time. Again, just like Professor Black had said that initially the survey that was going to be administered in the community from the Alzheimer's Association was 10 or more pages. I have seen people give individuals a 10, 20-page survey and give them no compensation or maybe $5 for their time. Again, that speaks to, do you value me as a participant, as a person, and also do you value my time? After providing online informed consent, participants were asked to provide demographic information and information about their medical history. Participants were asked questions about their perception of Alzheimer's disease, using the Alzheimer's Knowledge Questionnaire, their level of social support, their degree of religiosity, level of self-efficacy, and their level of participation in various physical, mental, and leisure activities. So I asked them, did they bike regularly? Do they walk regularly? Do they swim? Do they play Sudoku or chess or checkers? So it was quite a comprehensive survey. To establish baseline cognitive functioning, participants were asked to complete the Cogstate Brief Battery, a computerized screening platform that can be completed at home. They were also asked to complete the telephone interview for cognitive status, which is a 10 to 15-minute telephone administered cognitive screening survey. The TIC, as I said before, was administered by my students, and I can honestly say that my students truly did enjoy interacting with my study participants, and my study participants truly enjoyed interacting with my students. There were some study participants who, because they were able to interact with students, that they wanted to participate. The majority of the sample was female, and surprisingly, over 50% of the sample had completed a master's degree. So 50% of the sample worked full-time, although a third had retired. The sample was somewhat active in their community. 56% reported participating in their community church or a hobby for one or more times during the month. 58% of the sample had hypertension, and over a third had high cholesterol and a history of smoking. And although only half of the participants rated themselves as being overweight, when I did the BMI calculations, it revealed that 90% of the sample could be deemed overweight or obese based on CDC calculations. 45% of the sample reported a relative other than a mother or father having been diagnosed with Alzheimer's disease. So that could have been an aunt, an uncle, or siblings. When asked questions from the Alzheimer's Disease Knowledge Questionnaire, 82% of participants did not feel that their family doctor was trained to diagnose Alzheimer's. And this is important because patients might not bring up their memory concerns because they don't feel confident about their physician's ability to address them, leading yet once again to diagnostic delays. Although a slight majority of participants were aware that a primary symptom of Alzheimer's disease is memory loss, despite having a high education level. Again, remember, over 50% of my participants had a master's degree or higher, and SEX levels, I believe my average income level was $90,000. 42% of them felt that significant memory loss was a normal part of aging. This speaks again to the need for more education in communities of color, regardless of level of education or SES. While a majority of participants felt that diet and exercise were important, 60% felt that socio-cultural aspects, such as God's will, was a possible cause of AD, and this might account for delays in diagnosis, and also it may contribute to the normalization of the disease. Roughly a quarter of the sample felt diet and other lifestyle factors were only somewhat important, and these individuals would benefit from an educational intervention on diet and lifestyle factors that may protect the brain and reduce the risk of AD. These outcomes once again underscore the need for more education regarding modifiable and non-modifiable risk factors for AD and the importance of maintaining brain health among African Americans. Study findings underscored the need for Alzheimer's disease education within minority communities, regardless of education or SES status. Again, you may have an individual that may have a master's or a PhD, and a physician might assume, oh, this person is highly educated, they should know if this starts to occur, or they should be able to recognize, and that's not always the case. It is notable that although this sample was highly educated, 42% of participants felt that significant loss of memory, again, was a normal part of aging. And this normalization of memory loss as a part of the aging process continues to contribute to diagnostic delays, less effective physician-patient communication, and also disparities in treatment. One of the things that I did want to stress, given the fact that my study was completely remote and online, is that if you're thinking about doing this type of work or study, expect the unexpected. The Cox State, which is is a valid tool that has been used across many universities, remotely as well as in-house as a cognitive screening tool. When my participants try to access the Cox State, and I've had it set up so that they go straight from the questionnaire right into the Cox State, so it'd be a smooth transition. When they went and they clicked on the Cox State, unfortunately, if they were using Chrome, which probably at least 70% of most people do, they were prompted that they had to download an updated version of Adobe Flash. Or they just had problems, period, opening up the Cox State itself. And I was told that because Adobe Flash they're replacing it of some sort for whatever reason, that was what was creating the problem. They told me that if my participants went via Microsoft Edge or used Explorer or Firefox, they wouldn't have that problem. So I tried to inform my participants of that. But truly, if you have someone that, is over 65 years of age, maybe they're not that confident about using the computer. And many older people that I know, they don't like to download anything. So for them, it was, a deal breaker. Okay, but again, that was something unexpected. So always be open to, what's your plan B if you have to have one. Embrace technology. I initially had my students to call from campus before the pandemic. And again, keep in mind, on one hand, I thank God that I was able to continue this study because I was collecting data March 2020, and I will remember that date. It's solidified in history because that's when kind of everything started to fall apart. And so for me, because everything was remote, I wasn't as affected as some of my colleagues who were immediately told that they couldn't come on campus or their students couldn't be in the lab, their students couldn't do community-based research, so their research came to a halt, okay? But my students initially were making phone calls from the university, so if they were calling one of my participants to administer the ticks, when they called, it would come up Hampton University. So that was really helpful because people were more likely to answer the phone. But when the pandemic hit and they had to go back home, initially they started using their cell phones. And I didn't feel comfortable with that because I didn't want them calling, people and people to have their phone number. I didn't want them to be constantly using their own cell phones. So there was a technology called Telsio, and it's a computer-based phone system that allows you to make calls, from your computer. And not only can you make outgoing calls, but people can even call you and leave a message. And I could assign my students an extension number as well. So again, because of this, because of the situation, by my embracing technology, we were able to continue to go forward. The recruitment process has to be continuous. If you're going to recruit or use your digital community or to recruit individuals remotely, it can't be one and done. It can't be you send out one email on Monday and you don't send out another one to the next Monday. It has to be almost like a machine. It has to almost be like a fire that you constantly feed. There are so many organizations out there that have that national reach, whether it's NAACP, National Baptist Convention, National Council of Negro Women, the Hispanic Heritage Foundation. Again, what you're doing is you're looking for that gatekeeper who has access to that listserv. So oftentimes, if you go online, the board of directors, they will have their board of directors listed and an email address that you can reach out to that person. Also too, again, I reached out to sorority and fraternity presidents who had access to their listserv, their membership listserv. Let's see, I would suggest to you that you send out an email to these individuals, introducing yourself, introducing your cause, and also attaching a flyer so that they have everything that they need to either forward that information on or even, send your flyer or print it out for you. Okay, so they shouldn't have to call you back and say, well, can you send me some information? Can you send me a flyer? That should all be a part of that email. Social media opens up the participation gate to everyone. So some things you can control and some things you can't. So because of that reason, I was very targeted in terms of the people that I reached out to, because again, I was just so terrified that I was going to get a college student on the bed eating pizza and just constantly filling out surveys to get a $25 gift card. So, so I was maybe overly cautious because of that reason. I want to send out a special thank you to the Johns Hopkins Alzheimer's Disease Research Center for Minority Aging Research for choosing me, to be a scientist. The program did an excellent job of making scientists aware of speakers via online Zoom sessions, exposing us to cutting edge research by visiting scholars from across the country. Even if I couldn't make the talks, I was still exposed to the topic ideas that they would be talking about. And I always felt like I was a part of a larger community. Dr. Albert actually is a core leader for the RICMAR and also a mentor. So thank you, Dr. Albert. And again, Hampton University is a relatively small university. We don't have necessarily access to a lot of resources. So with the RICMAR, for me to be able to have access to a community liaison and recruitment core, I could ask them about ideas about recruitment, the research education core, the administration core, the analyses core. I've met with their statistician, Jeannie, many times and asked her about, different questions about how to handle the data, about my research question, about the analyses and the statistical analyses that, I can test that I should use or do. So again, the RICMAR for me was just a tremendous help. The initial study used an innovative, entirely internet-based data collection strategy. Again, this was the African-American Dementia, the African-American United Memory and Aging Project. And the project demonstrated that the study was feasible. It demonstrated that, it could be used as a mechanism to reach middle-aged and older Black adults in the US that have been commonly hard to reach. Do keep in mind, I don't think that I reiterated that I was able to recruit 256 African Americans. The pilot was funded from the RICMAR. This pilot led it was the impetus for the Black American United Memory and Aging Project. And we changed the name from African American to be more inclusive to Black American United Memory and Aging Project. And so, we went forward in terms of, we had this pilot data, so it was suggested, okay, let's expand our study to a larger, cohort of individuals, this time inclusive of African Americans who had both a high and low level of education. And I'll go over my aims next, but our efforts led to our being funded recently in the form of an R01, and the grant itself was funded for $4.8 million. And again, I simply say that to say, had it not been for the RICMAR and had it not been from the excellent mentorship, Dr. Pettigrew is one of my mentors that I received. Dr. Roland Thorpe is another. I wouldn't have been able to be able to acquire, to get to this point where I'm at the R01 point now, and we're going forward with the Black American United Memory and Aging Project. For the Black American United Memory and Aging Project in AIM 1, what we want to do, we want to know which remote testing modality do participants prefer. So do they prefer a cognitive screen using a PC approach, or would they prefer a mobile app in which they can download a cognitive screening test, or would they prefer us sending them a phone? In AIM 2, we want to know what demographic, lifestyle factors, and environmental factors, inclusive of neighborhood location, and also perceptions of racism, are associated with cognitive function and cognitive decline. These particular concepts or constructs I did not examine in the African American United Memory and Aging Project. So I'm really excited about looking at those particular variables in this upcoming study. Finally, we wanted to determine if various risk factors like cardiovascular disease, telomere length, and inflammatory biomarkers affect cognitive function in our cohort. So we're asking our participants, if they wouldn't mind, sending us a salivary sample, just a simple swab, and also a urine sample. Again, I wanted to expand the study so that we had some type of biomedical component. And I said to myself, I was like, well, I don't want people to send them to a lab and have blood drawn. That's a little bit convoluted. It might be a little bit of an inconvenience, but what can they do in their own home? What can, from the perspective of us being able to collect biomedical data, what can be done?
Dr. Hughes, we have about another 2 minutes.
Okay, and I'm just about done.
Great.
All right, and so these are the members of my team. Again, I will reiterate that, Dr. Pettigrew is a part of that team, Dr. Thorpe is a part of that team, and they were my original mentors when I was doing the pilot study. And I'd also like to take the time to acknowledge some very special individuals. Without their support and guidance, the study and the eventual R01 would not have been possible. I have been blessed to work with some extraordinary people, some extraordinary and brilliant mentors like Dr. Thorpe, like Dr. Marilyn Albert, and also like Dr. Corinne Pettigrew. I can't thank them enough for brainstorming with me, helping me to solve problems, pushing me when I needed it, holding me accountable. It's truly been an honor to work with them. I also want to thank my study participants, the Web Service Department at Hampton University, and also the National Institute of Aging. And that is it. Thank you all.
Thank you so much, Dr. Brown Hughes. We really appreciate the session. Do we have any questions for Dr. Hughes, Dr. Brown Hughes?
I have something I would like to, not a question. Well, it's kind of a question and something I would like to say. So I'm Misha. I loved your presentation. I was wondering, would you be interested in speaking to or doing research on some seniors at adult daycare or senior center?
Sure. Would they be interested in being a part of the BAU map study? Is that what you're saying? Or
the last project that you spoke about?
Yes, sure. Yes, that would be great. They just they cannot have a diagnosis of Alzheimer's disease. That's the only thing. But if they're 55 or older, African American, and they don't have a diagnosis of dementia or Alzheimer's, then most definitely they'd be able to participate.
Okay, so I have 2 centers in mind. So I'll get your email and I'll
Please do.
be in touch.
Please do. I would love that.
Thank you.
Thank you. Any other questions? And feel free to put them in the chat as well.
I have a question. Can you hear me?
Yes, ma'am.
I want to thank you, first of all, for delving into the topic such as you have done. My concern is there any part of your study which looked at the relationship of the participants to a family physician, a medical doctor? Is there any part of your study which looks at how these African Americans in the study related or had a relationship with a family physician who was a gerontologist or who was a specialist with regard to memory loss and dementia?
My questionnaire didn't get that specific. I primarily asked, did they feel comfortable or did they feel confident that their primary care physician would be able to actually diagnose Alzheimer's disease? And many of them did not feel confident that that primary care doctor was able to do that. So that says to me that, referring someone to a specialist is all the more, important. But I will say to you that when I did my dissertation, I looked at barriers and bridges to a diagnosis of Alzheimer's disease among a group of African-American caregivers. And what I found was that sometimes that primary care physician could be a bridge, and sometimes it could be a barrier. Sometimes having a family physician that you've known for so long, that doesn't always mean that they're willing to have hard conversations with people, that they're willing to bring up the fact that, maybe you might want to think about not living alone. So that can be a barrier to their receiving a diagnosis. And then sometimes it can be a bridge because the person, if not that person, but maybe that caregiver, that daughter, that son might feel comfortable, having a sidebar conversation with that physician and saying, hey, mom won't say, but I'm telling you that there is. So, but that aspect of communication is very important.
I know it's very important. And as a facilitator for a large group, I find that is a profound problem and concern because most of the members of my group that I've been involved in over the last 5 years rely on family practitioners who are neither gerontologists, who have not studied, who have the least bit of knowledge with regard to memory loss and dementia. And I find that very sad. Unless the members take time to investigate on their own and be a part of the program at Johns Hopkins or the one at Greater Baltimore Medical Center, most of them have doctors who are not at all knowledgeable and cannot help them as they should be helped at an early stage. And this has been a concern of mine for quite some time. And I'm wondering if, as you continue, you can look at that, particularly to the extent that there is a referral list, some kind of, and I don't know where it would come from or who would do it, but most of the members, and there are 25 members in my group, they have general family doctors. And there are things that I have learned over the years that I can share with them that their doctors are not telling them. I think that's a profound area of concern for Black Americans.
And I agree with that. And it's like so many layers to that in terms of what are these family physicians being taught at the medical school level, one, but then something else you can do from the community level is to empower people, to have them have that list of questions that they can go in with and they can ask their doctor. And that goes a long way.
I wonder too, this is Anna Smolensky. I loved your presentation. And I wonder too if it's possible, maybe even having this presentation for, population health within health systems so that the primary care physicians are able to see this great work, the data behind it, and empowering them to be able to have those courageous conversations about where someone is in their overall journey when it comes to medical care, when it comes to their overall health care.
I agree. I think that's an excellent idea. I will also say that another outcome from my dissertation was that many of my caregivers said that it wasn't as if they didn't bring it up, that there were issues going on with their loved one, but they often said that that family physician only had 15 minutes, and that 15 minutes they're worrying about their diabetes and the high blood pressure that's off the, just through the roof, and the A1C that's 10.1. And, so that, the physician is like, okay, I got to take care of these things because that's first and foremost, and then we'll get to later. And that later may come much later once there's a crisis, or it may never come at all. So again, there are multiple issues. One, those that are at the policy level, in my opinion, that need to be changed.
Well, and thank you. I'd like to also say thank you too for a wonderful presentation. And I'm thinking when you said diabetes, are you starting to see, or is there really a major connection between type 1 diabetes and memory loss, or type 2? And given that those are definitely a common disease in the Black community, and I'm just wondering if you've thought about doing any research with that, or have you already done some?
Yeah, so there's a lot of research that has been done in that area, and that diabetes, unfortunately, over time affects the vascular, not just in the body, but also in the brain. So if you think about, oftentimes people with diabetes will experience neuropathy. They will experience those small blood vessels in the fingers and the feet, but those small blood vessels are in the brain too. And that, because of that, diabetes puts a person at a greater risk for what's called vascular dementia. And so they may have a series of strokes in certain areas in the brain. And it also puts them at a greater risk of even transitioning to Alzheimer's disease. So there has been quite a bit of risk. And if you think about the prevalence of diabetes and hypertension, it also affects the vascular system of the body. Those are two reasons why, those diseases are very prevalent in the African American community. So both of those diseases put African Americans at a higher risk of developing the disease, unfortunately. So that's
when we're
why
sharing, when we're sharing information or resources, it kind of like goes hand in hand. There will be awareness that, if you have this is why you want to prevent that.
Yes,
because you have this.
Yes, ma'am. And always remember, what's good for the heart is good for the brain. So
yeah.
Jasmine. Thank you for this presentation. Thank you for sharing your research. It was great. You mentioned that your next study, in addition to other factors, you will research the impact of experiences and perceptions of racism on brain health for your core demographic. I imagine that self-reports will be used to do this. Can you talk briefly about other measurement tools that you'll use to gauge that impact?
Yeah, so we're looking at, what aspects of one's neighborhood, in terms of what aspects of your neighborhood that might raise one's stress level, and that heightened level of stress leads to heightened levels of cortisol, which can lead to heightened levels of inflammation in the entire body. So, whether it's crime in one's neighborhood, the degree of crime, also, again, one's perception, of racism, and this idea of over time, like what's called the weathering effect, that, certain factors have an adverse effect on, particularly on the overall health of African Americans. So, so those are some of the factors that we're looking at, but we're still kind of working out, and I'll be calling on Corinne for her help with this in terms of what measurement tools that we're going to put, in that questionnaire. And you always walk a fine line of wanting to put in the kitchen sink, but no one's going to fill out the kitchen sink. So what are those important, dead on target surveys that you're going to want, to ask, and what do you want to include? So.
Thank you. I think that's a phenomenal area to look at, and I was just really intrigued when you said that. So, yeah, that's really really interesting. And I often wondered that myself. Like what, personal experience that I've had and perceptions that I've had, like how, because it's an actual effect that you can feel. Yeah, I can feel in my body. And various experiences, and then having to like work through those, and I wonder about long-term effects of that. So I'm really looking forward to
necessarily isolated effects, but what happens when those effects are consistent on a daily basis over time? How does that affect one's mind, but also how does that affect your body? So
thank you.
Thank you, Dr. Brown Hughes. We really appreciate your presentation, and thank you for everyone for these thoughtful questions. This is about the time in our session when we typically do our call to action by Ms. Ernestine Jolvet Jones, but unfortunately she's unable to attend this evening due to a loss with her family. And so we'd like to provide our prayers and thoughts for her and just give a quick moment of silence to honor those that are impacted right now. Thank you. So I'd like to now introduce Misha Saunders. As most of you know, Misha is a MACAB Vice Chair, and through physical activity, she plays an active role in educating and advocating for older adults about topics related to memory loss and dementia, and she will be providing the call to action tonight. Misha.
Hey everyone, I hope you all are doing well tonight. So tonight's call to action. So thank you, Ms. Marlon Taylor and Ms. Trevonna Brown for your lovely presentations. I want you all to encourage people in your community to reach out to their gatekeepers to spread awareness of healthy aging through testing in our minority communities. Encourage your friends and families to get second opinions if you are not receiving the attention that you need from your provider. Please inform people within your community that memory loss is not a normal part of aging, and encourage everyone that it may be a form of dementia and Alzheimer's, and they should get tested for precautionary reasons. Thank you so much.
Thank you, Misha. And last but not least, Dr. Albert will be providing tonight's closing remarks. Dr. Albert is one of the founding members of the MACAB, and she is a professor of neurology and director of Johns Hopkins Alzheimer's Disease Research Center. Dr. Albert.
Well, it's really been wonderful to spend the evening with all of you. I always find this event so inspiring. Everybody's passion and dedication is really remarkable. I had a real sense tonight of the progress that we're all making. The idea that Crystal Day Black had years and years ago about having her nursing students begin to work in Alzheimer's disease, and then how it grew and flourished over the years. And it's so fabulous to see the progress that Trevania has made, and to see the grant that she's going to be, now embarking on. And I just thought it was wonderful that we all talked together. It's been very hard with the pandemic. We're all separated, but we really had a conversation this evening. And I just thought it was a wonderful evening, and I hope you did too.
Thank you, Dr. Albert. And thank you, everyone. We really appreciate your attendance tonight. And